brief introduction about
My name is Rajath, and I am the Managing Director of Biomerux in India. Biomerux is a global healthcare, I would say a healthcare partner for our doctors, our clinicians, and we work in the area of diagnostics because it's clear increasingly with the complexity of infection that evidence-based medicine is the critical need not just for today but for the future. So we work with clinicians in 110 countries to understand what are the diseases that are challenging them, what are the kind of answers they're looking for, and how can we help by developing those answers in the best possible time with the best possible result. In India, we are present across the country in hospitals, in laboratories, many of which are very well known, and I won't name one or the other, but I let it say that if you are going to get a test done, very often it's on one of our equipments with our tests, and our commitment is to bring the same level of quality and precision for patients in India as we do everywhere else in the world.
In my particular case, my name is Marcelo Cloes. I am the Vice President of Global Marketing with the Microbiology Unit in Biomerux. Essentially my role is to, and my group's role is to liaise between the customer unmet needs in the different countries. Reason why I am so happy being in India in these days, in order to understand better which are the customer unmet needs in different countries and liaise with our research and development team in order to have the best product development that will translate into the best product that are hopefully satisfying those customer unmet needs.
And what are the key points you're focusing through this Microcon 2030?
I think Microcon is really for us, we are always, if you look at our position, we are the global leaders in microbiology. We offer the widest range of solutions, and therefore Microcon is an opportunity for us to present what we do, but also to understand, because you have many of the leading microbiologists of the country, clinicians coming here. It's an opportunity to speak with them, to understand the work they're doing, and to understand what are the needs that they feel we meet, but what can we do better in the end to serve the patient who comes to a hospital or a lab for a solution to a health problem. So Microcon is a unique opportunity to meet these people in a group, to listen to their expert opinions, and to share with them what is it that they expect, what would they like us to do next.
Ma'am, how are you dealing with the gap between a practitioner and a microbiology research?
I think, we have to remember that until in India, certainly 10 years ago, or maybe I would say 15 years ago, microbiology was kind of a dark hole. Many microbiologists, based on their experience and training, felt they could smell the disease, they could practically talk to the disease. And doctors and clinicians felt that this was not a precise science. But over the 50 years that Biomerux has been in existence, and this is our 50th year, we have developed tools to support the microbiologists to be accurate, to be reliable, and I think that gap is getting narrowed, where our own clinicians are beginning to appreciate the value of evidence-based medicine, and we know that this helps cure a patient faster because you are able to identify exactly what is wrong with the patient, and of course with the susceptibility test know which medicine will be most effective. And a very good example, because for us in India this is a big issue, is the growing antibiotic resistance. The problem is that we can buy any medicine, anytime, without a prescription. The government is now talking of controlling this. This is a threat that we don't even realize how serious it is. If you take a broad spectrum antibiotic for a small cold simply because somebody else was taking it. When you really need that antibiotic, you will not respond to it. And increasingly we know that drug development, because it's very expensive, is decreasing and resistance is increasing. So I think one of the key roles that we have is also to help clinicians understand the significance of this. And in India we denied it for a long time, but today we know that multi-drug resistance, that extra drug resistance exists, and there are no cures for extra drug resistance today, none in sight. So we believe that we do have a very important role to play in helping, and the microbiologist plays that role. It's not us. We offer the solution, but it is the microbiologist who is able to do that test, who is able to advise the clinician and say, this patient has this, and this medicine will react best. So you save money because the cost of treatment can be expensive. And if the patient has to stay in the hospital for a long time, it's very expensive for the patient. So you can save money, but more importantly, you can save the patient's life. And that is the role that the microbiology, the specialist plays, is to be able to show evidence of what disease the person has and what is the best way to treat that patient.
Compared with the other countries like Germany, is India lacking in the field of research coming to microbiology and biotechnology?
No, I think it's not in every country, whether it's the US or Germany or France or India, there are thousands of people everywhere in the world working on research and development of new tools. Take what we have found right here in Hyderabad. We identified a small company created by two researchers who have developed not rapid tests, but molecular biology tests. And today, we as Biomerux have invested in this company. We have asked them to stay as shareholders so they benefit from their work. And we are working with them to bring these tests to a global standard. So it's not just in one country. Biotechnology in India is strong, IT is very strong. So in many of the solutions we offer, IT is the driver of that solution. So India is becoming a base, but yes, traditionally, because more money was available, more resources were available, the US and Europe were the leaders. Japan has many innovations as well. So I think it's a global phenomenon. I think that perhaps research is more advanced in what we call the West or the developed countries, because they've been doing it for a long time. We have now started to recognize the value of research, and we have so many institutions. Today, the government of India has somebody as the head of medical research. Dr. Katoch, who is the Director General of ICMR, is also the Secretary of Research to the government of India. So there is recognition that there is work happening in India, and that we need to set the guidelines, we need to give the encouragement, and of course we need to find the funding, because medical research can be very expensive.
And finally, how Microcon 2013 is going to benefit a common man?
I think, you know, if you look at what all of us do when we get up in the morning, companies like ours, people like myself, my team, the clinicians, the microbiologists, the pathologists, there's one person at the end of that vision, and that's the patient. Now that patient could be me, it could be someone I love, and somebody loves every patient. You know, this is what I tell my team. So what Microcon does for that patient is to bring together experts from hospitals across the country and people from industry like us to talk about the prevalent diseases, the emerging diseases, the challenges to treat those diseases, and by exchanging best practices and experience, we all go back richer in our knowledge and our ability to serve the patients and what they are suffering from, So Microcon contributes to building that understanding, to building that shared experience and knowledge, shared best practices, so that each person goes back with learning and with an opportunity to do something they are doing better, to help the patient quicker and potentially more accurately to save a life.
Just one more question for the panel. Taking of the similar wavelengths that you had mentioned earlier, we've talked about biotechnology and how India is a hub for technology. And the other thing is, with globalization, I mean, there's been transport of goods, people coming here and there, they become the perfect carriers for, you know, the diseases or whatever you call it. And there are associations like IAMM and ACM. So how do you see, I mean, being a company which is trying to provide, being in the private space, how do you see there is, you know, help or assistance from government bodies or associations of that to look at establishing such centers in, you know, developing countries? That's my first question. Second is, India or Hyderabad has positioned themselves being, or something like medical tourism. You know, we have a lot of people from outside India coming here, taking the treatment for various reasons. One could be cost, one could be treatment, or, you know, the good feel which is provided here.
The level of service.
Exactly. So how do you see, you know, this sort of taking up from here, and they really need to be abreast with, you know, the best technology in terms of turnaround time also. I mean, you know, a private company can give you something that is there for them to sell because that is what they make a margin.
Right.
But, you know, there must be a really good understanding between both the parties.
I must
so that,
first tell you that margins in India are the worst in the world.
Right.
And it's true because I deal with it every day. I'm being very straight about this.
Right.
We have agreed that we are not in India to make a margin, but to make public health improve. Yes, we need to cover our costs, but we are not in other countries. If our margins are 60%, in India there may be 20%, and that is used to have a team, to have an office, and to be able to support and provide. So net, you're not in it for money. I think that there is, and this is a concern, and we have tried to bridge it by not being commercial in everything we do. There is always this concern that are you going to only be here to sell? And I think our approach is no, we're here to also learn, to share, and to tell you what we have today. And you can tell us what we can do better. Globally, associations work with industry to actually guide industry, to participate in the development of new solutions. And I think this is what, moving forward, we look forward to from art associations in India, that they should also be a route to share the needs of the industry, not just at a meeting like this, but in an ongoing dialogue. If you were there, the Honorable Governor said that we should look at public-private partnerships. It's a very important action. It's not one that we as yet, and I don't mean we as a company, I think we could do better.
Right.
And I think associations like these that represent the medical community could play a very important role in helping us make healthcare more affordable, but also in driving the future agenda of companies like ours, so that there's a real partnership between the medical community and the solution providers. So I think this is a work in progress. I think meetings like this give us a chance to exchange. Obviously, we continue to talk on a one-on-one basis, but I sincerely believe that the associations have a role to play in presenting the challenges and driving industry to bring the best solutions to the table. And this is what we hope to continue to build as we move forward in these relationships.
Last question, if both of you could answer in less than 30 seconds. How much of, you know, what is being talked about in Microcon 2013 do you see is going to become a reality? In 30 seconds, sorry.
Ajay?
I am precisely presenting in a conference in the last conference of the show with respect to precisely the interaction between the industry and the public health and clinicians in India. concretely speaking, molecular tools are going to be more and more widespread used in the clinical setting with an approach of true sample in, result out, without minimal human intervention in order to offer very sensitive and very specific results. And that is going to be more and more widespread thanks to having those techniques being massively adopted, lowering down the cost, therefore making those more affordable, and impacting more, therefore, the public health.
I think to answer your question, much of what was shared at this meeting is already a reality. It's there. We had some of it on display, and some of it is already existing. The rest is in process. But what our interest is, beyond what is in process, and the whole issue of affordable quality. Because the raw material for quality, the processes for quality are expensive. How do we find a way to make the same level of quality available at a lower price? And in countries like ours, which are resource challenged and the population is huge, this is a very big concern. And I think that is where a lot of the serious work will need to be done, is being done, but there's still a long distance to go. But I think what was discussed in this conference is pretty much a reality because it's almost on the table, or it is on the table. I think it's the next step that is hard to predict. Development is not a short, quick thing. But I think what is good is that there is a seriousness of purpose that will make these, that has made what has happened today happen, and will therefore drive the future as well to make sure it happens.
Thank you, ma'am, for sharing your views, and thank you, sir.
Thank you very much. Thank you.